We have a lot of daily challenges just in making sure our patients are getting, the best care possible, and making sure our faculty have the access to the right equipment that they need. Their doctors, I being a doctor myself, we always want new toys, so when the new technology comes out, we're wanting to be first on that bandwagon. I'll give you an example of that. We just got the latest Da Vinci robot here at Tulane, so we now have 2 Da Vinci robots, and we have the most modern robotic technology here now at Tulane. Our doctors are really excited about. So that's a challenge because, capital is at a premium, and so we have to prioritize what we're going to buy and when and make that part of a real strategic plan. And then the other challenge that we have is just trying to plan and execute strategies in an uncertain environment. So, for instance, Louisiana is going through a lot of budget challenges now, and the new governor is considering a lot of budget cuts, and depending on what actually happens, that'll affect the services that we're able to offer. So we do it on 3 things. One is it a mission-based need? So is that something that is not in our community that our community deserves? And so if we don't have it in the community and our doctors have expertise, then that gets a high priority. Then the second is, how profitable is it going to be? Because there are technologies that you can buy and do and actually lose money on. And so our doctors want to make sure we're making the right business decisions on buying new technology to make sure that it is at least break even, if not profitable on each case. And then the third is, what kind of difference can it make for our physicians and their patients? So the robotics thing is a great example. We can now do surgeries on folks and have their recovery time be so much lower that some of the surgeries now are actually outpatient. So we can do a procedure during the day, and there's so little pain associated afterwards that they can, in many cases, go home that evening, which nowadays qualifies as an outpatient surgery. So just a dramatic difference in the patient experience and in the experience for our doctors. So then those things get high priority. Well, I'm a Tulane graduate myself, so I went to undergrad here, and my family has a long family history of Lunds having gone here. So for me, this is coming home and being an opportunity to give back, so I hope to be here for a long time. But in terms of the medical center itself and the faculty are what keep me coming back. The idea that Tulane is going to become a top-rated academic medical center, one of those honor rolls that you read about in U.S. News and World Report. We kind of view ourselves as a medical school as very similar to Duke and Vanderbilt and Emory. And our academic medical center, we would like to have those kind of high ratings that our sister medical schools have. And so that journey of being where we are now to being an honor roll hospital is what will keep me here. Very much so. Oh yes. So Tulane's a partnership with HCA, so we're one of the largest hospital corporations, and yes, acquisitions and partnerships are always on our mind, and that's certainly going on in the market here. It gives Tulane a whole lot of comfort and power that we've got 160 some odd hospitals, both nationally, and then we have some hospitals in the United Kingdom even. So our balance sheet, our ability to invest capital, our ability to do things like supply chain management and technology and leverage our scale is really second to none. So Tulane, we're kind of really sitting pretty. Growth. So our city's projected to grow by about 10% population over the next decade, and that's projected to be patients with both Medicare as the population ages and then commercial insurance. And so those are 2 attractive payer mixes for any health system. And so we're going to need to grow in order to be able to serve that patient population. So we're looking at what we can do on our own campuses to grow, and then we are looking at what we could do to grow by acquisition and partnership. So for us, it's exciting because it means being able to recruit new faculty and be able to recruit new nurses and other providers where we can provide just really cutting-edge care for the patients in this community. Yeah, definitely. So the first relative that of mine that graduated from Tulane did so from the medical school in 1870, and so we've been coming here for generations. So it's a big deal for me to be able to give back to a school that has meant so much to me and my family.